Welcome to our Strengthening Respiratory Anatomy aerobics class.
We're so glad you could join us on our super rad activity today.
By the end of this video, you'll know the ins and outs of all your respiratory anatomy for singers.
All right, everyone, kick your gluteus maximus with us to get your blood moving.
1, 2, 3, 4, 5, 6, 7, 8.
1, 2, 3, 4, 5, 6, 7, 8. Great job, everyone. You look amazing.
Let's start by turning your head side to side to get your neck moving.
Your skull sits on the atlas and it turns on its axis, the top 2 vertebrae of the spine.
Those are part of the 7 cervical vertebrae.
The next 12 vertebrae are called the thoracic vertebrae.
Then there are 5 vertebrae that are called the lumbar vertebrae.
At the bottom of the spine, there are 5 vertebrae that are fused together to form the sacrum.
Feel your thorax stretching?
Your thorax is also called your rib cage. Each person has 12 pairs of ribs.
Most of your ribs connect to the sternum, which is in the middle of your chest.
The bottom 2 pairs of ribs are called the false ribs because they don't connect to the sternum.
At the bottom of your sternum, there is a small projection called the xiphoid process where some of the abdominal muscles attach.
Let's take a breather.
Hey, want to know a fun fact?
Totally!
The lungs are organs, not muscles, so they can't move on their own.
So how do they move when you're breathing?
The lungs cling to the wall of the thorax because of the pleurae.
Pleurae are more like a wet plastic bag that sticks to a window than double-sided tape.
Because the lungs are attached to the thorax. When the thorax expands, the lungs expand.
When the thorax gets smaller, the lungs do the same.
When the thorax expands, it creates a vacuum and causes air to rush into the lungs and fill the space.
When the thorax gets smaller, pressure inside the lung increases, causing air to rush out.
This radical phenomenon is called Boyle's law.
Let's do a recap.
What law states that pressure and volume are inversely proportional? That's right, Boyle's law.
Wait, so how does the thorax expand?
Well, there are 2 main muscles for inhalation.
The external intercostals expand the rib cage, and the most important inspiration muscle is the diaphragm.
The diaphragm is shaped like a dome and separates the contents of the thorax to the abdomen.
It is one of 2 unpaired muscles in the body. When it contracts, it flattens and pushes the abdominal contents downwards.
When it contracts, it moves 3 to 5 centimeters.
But during deep breathing, it can move as much as 6 to 7 centimeters.
The diaphragm is exclusively a muscle of inspiration, meaning that it does not push air out of the body.
So can we sing from our diaphragm?
No! So we've talked about respiratory muscles. Now let's talk about expiratory muscles.
There are 5 expiratory muscles: the internal intercostals, the rectus abdominis, transverse abdominis, and the internal and external obliques.
Internal intercostals are directly underneath the external intercostals, and they pull the ribs inward and down when they contract.
Let's get on the floor and do some crunches. Now that we're on the floor, let's do some crunches.
There are 4 sets of abdominals that help with exhalation.
The rectus abdominis runs longitudinally up your abdomen and inserts at the xiphoid process.
Feel your rectus abdominis contracting?
Let's do some bicycles. This move works your internal and external obliques.
Your internal obliques go away from the belly button and your external obliques go toward the belly button.
Let's do some flutter kicks. The deepest layer of the abdominal muscles is the transverse abdominis.
These muscles run horizontally from the rectus muscles to the spine.
Now you know about all the ins and outs of your respiratory system.
Thanks for working out with us today.